Good evening. Welcome to The Bachelor. Stay tuned to see which lovely microbe Garrett will be taking home with him today.
My last girlfriend was sort of, you could say, a hot mess. Her name was Clostridium difficile, and she went by C. diff for short. She caused inflammation of the colon, and this often was caused by antibiotics. She is gram-positive, spore-forming, and bacillus-shaped. C. diff is anaerobic and very motile. She is found in soil and spread due to contaminated water and or food. She's so common to the general population, infecting over 200,000 people per year in the United States. She is very well known at long-term care facilities and hospitals. She seemed to mess around with people who were like 60 years and older, typically men. Let's just say she was a flirt. C. diff was the most important cause of infectious diarrhea in the United States. She can cause frequent watery diarrhea, severe abdominal pain, loss of appetite, fever, blood in the stool, and weight loss. Yeah, she's very toxic, you could say. All right, enough about my ex and on to my next love.
Hello, I'm Clostridium tetani, but most people just call me Tetanus for short. My best friend is Rusty Nail. We're together so much that everyone just associates us with one another. We go back a really long time. You should pick me because I don't require oxygen. I'm found everywhere, in spores, in soil, in dust, animal intestines, feces. If you have me, I'll give you rigidity and extreme muscle contractions. And if for some crazy reason you want to prevent yourself from getting me, you would need a vaccine that is updated every 10 years because I'm always changing. But vaccines are the reason my love life is on the decline in developed countries. But I won't lead you on, but I will lead you to respiratory failure and sometimes death if you're into that kind of thing. And if you don't want kids, I'm your girl because I only produce a potent biological toxin. I won't cheat because I can't spread person to person, but I am motile so I can move to you. I hope you pick me.
My name is Pseudomonas aeruginosa. I think Garrett should choose me because I'm an opportunistic pathogen that is capable of infecting almost any body site given the right conditions. Not everyone can do that. He won't ever be lonely because I can be found in soil, water, skin flora, and most man-made environments. I cause a lot of trouble for burn patients, cystic fibrosis patients, and anyone with a catheter. If you think that's bad, I recently shut down 2 NICUs in Maryland. Another factor that makes me better than the other contestants is that I'm progressively becoming more and more resistant to multiple drugs. But above all, my fruity sweet smell and beautiful blue-green color is enough to keep any man happy. Choose me, Garrett.
Hey, I'm methicillin-resistant Staphylococcus aureus, but everyone calls me MRSA. I like to think that I'm a very people-oriented bacteria. I've made friends with almost all of my antibiotic enemies except vancomycin. We're still trying to work that out. In my free time, I love visiting the hospital and checking out all the fresh wounds. It's like a giant buffet. Some people say I'm clingy and hard to get rid of, which I guess can be true because once I find a nice warm place to spread my bacterial roots, I don't want to leave. But I don't really think that's a flaw because you can count on me to be loyal and devoted to you. I'm looking for another bacteria that's going to let me spread out and not inhibit my growth, and maybe we can take over the antibiotic resistant world together.
Hi, I'm the not so famous but amazing Leishmania parasite. Garrett should choose me because the infection I cause is usually silent, so he won't even have any complaints about me. If anything, I'll just cause some little pimples on his face, but that's not a big deal. I can also help him lose weight. I'm really good at that one. I live in a tropical country, so if he chooses me, we can travel a lot and live in a tropical paradise. My only request for Garrett is to let me bring my sandfly friend with us everywhere we go. She's silent and small, so he won't even notice that she's there. She'll basically just make sure that we live together forever. She's wonderful. I don't know how I'd ever live without her. Anyway, if Garrett wants a pain-free life in the tropics with someone who will help him lose weight and only give him a few pimple-like bumps for the rest of his life, then he should definitely choose me.
Hi Garrett, I'm Treponema pallidum, but you can call me Syphilis. I think you should choose me because who doesn't love a cute girl with a spirochete figure and a gram-negative disposition? And plus, I'm super smart. I've been called the great imitator because my symptoms mimic a lot of other diseases and it makes doctors have a hard time to diagnose me, which is great because the longer I stick around, the more damage I do. First, I pick my target. Get a little romantic, set the mood, maybe light a candle. I mean, I am an STD after all. And a few weeks later, I hit him with a genital chancre. It's a pretty nasty looking ulcer, but it's painless, so a lot of people disregard it. Next, in secondary syphilis, I give them a little rash, even on their hands and the soles of their feet. It's embarrassing, but again, it goes away with no treatment, so I slide under the radar. And after that, I cut them a little slack. I lay dormant for a while, a couple of years, maybe a couple of decades, until I feel like bringing on the wrath of tertiary syphilis, which is my favorite stage. First, because it's the safest. At this point, penicillin can't touch me. Plus, I get to let out my creative side. I can give them some gumas, which are like disfiguring soft tumors on their face and on their body. Or if I'm feeling a little bit more adventurous, maybe I go with neurosyphilis. Give them a little nerve damage, maybe a little dementia, a couple of seizures. And if I'm feeling super evil, I'll go with cardiosyphilis, which basically leads to an aortic aneurysm. So that one's really fun. Anyway, that's enough about me. I can't wait to meet you, and I promise if you choose me, I'll let you choose tertiary syphilis symptoms whenever you please.
It's time for the rose ceremony. It's going to be a difficult decision, but I think I picked the tropical parasite. Blooper. My last.
I'm a weird person.